Greetings and welcome to this yet another video on emergency clinical differentiation of common fevers that presents to the emergency. This is a series on infectious diseases for physicians. This is Medicine Beyond Harrison's. This video is specifically for educational purposes. Let's get started. So, most important clue when the patient presents to the emergency should be the fever pattern. Influenza patients presents abruptly sudden high grade fever, usually of 1 to 2 days. The patient remembers the exact how the symptoms began. You could ask when was the time that it began. The patient will definitely say right after my breakfast, right after the dinner. It started. Suddenly high grade fever I got with a mild throat pain or some cough. This could be the ideal presentation for influenza. So for enteric fever, the pattern could be slightly different. The patient usually presents around day 5 to day 6 or the day 3 to day 4. The patient usually have a step-ladder pattern of fever or sustained fever which does not touch the baseline. The fever would be persistent despite giving paracetamol. There will be relative bradycardia for these patients. When you touch the pulse or feel the pulse, it should be less than 60. This is called the Fidget sign. For the dengue fever, it is usually the continuous high grade fever that subsides around the day 3 or 5, which is the febrile phase of the dengue illness. As we know already, the dengue fever has three phases. One is the febrile phase, which lasts for the first 5 days. The next 3 days, you would call it the critical phase, where there will be warning signs, bleeding, petechiae, rashes, abdominal pain, seizures, and all the complications of dengue due to the vasculopathy. And finally, the convalescent phase, which lasts for around on the day 8 to day 10 to 11. So where the fever defervescence happen, where the illness defervescence happen, the fever usually is gone by the around day 5. Yeah. So next, the COVID-19, which is a moderate fever, not the high grade fever as such of influenza. It is non-abrupt. The fever may be mild or completely absent in elderly. So general systemic symptoms for influenza, the patient will have intense body pain, retroorbital pain, similar to dengue. There will be sore throat, which is a differentiating factor where other fever does not have a sore throat. The patient will be acutely sick. That is, even on the day 1 or 2 of the illness, the patient will be looking very sick, toxic look. For enteric fever, the patient usually presents around the day 3, day 4, or day 5. They would have even tried basic antibiotics, basic analgesics, or antibiotics out from outside hospital before coming to the emergency. So, where the patient will have toxic appearance, coated tongue is yet another important finding in enteric fever. Ask the patient to show their tongue. It will be coated in most of the cases of dengue fever. There will enteric fever, and in case of, there will be mild abdominal discomfort and bradycardia, as previously discussed by the Fidget sign. In dengue fever, there will be breakbone. It's also called the breakbone fever, where there will be pain everywhere, every joint in the body, from neck to shoulder joint to elbow joint to the small joints, knee joint. The patient will have severe headache, especially in the frontal region, radiating up to the occiput also. There will be intense fatigue. There will be flushing of the face, flushing of the skin due to the vasculopathy, and there will be rash. For COVID-19, the important clinical finding should be the anosmia or ageusia. The patient will have loss of smell or taste. There will be fatigue, there will be mild myalgia, and there will be breathlessness. So, respiratory versus GI clues. Predominantly, this influenza and COVID-19 comes under the respiratory predominance, whereas the enteric fever and dengue fever will come under GI predominance. So, for influenza, there will be prominent dry cough, coryza, and sore throat, upper respiratory tract infection picture with acute toxic look with high grade fever with chills. Should be like influenza. Once you see a patient of influenza, you will remember completely how the patient should present it. For COVID-19, there will be persistent cough, hypoxia, and breathlessness, and mild low grade fever. Always rule out enteric and dengue fever. We usually have minimal or no cough. Although in few books and clinical practice, we have seen enteric fever presenting with dry cough due to diaphragmatic irritation or bronchitis. So GI predominance is enteric fever where you will have abdominal pain, constipation more than diarrhea. We always think any enteritis will cause diarrhea more, but in case of enteric fever, there will be constipation in more number of cases than diarrhea. So there will be splenomegaly. Look for an ultrasound to or a clinical examination to look for splenomegaly. These are soft clinical markers of enteric fever. Dengue fever, there will be vomiting, abdominal pain. These are warning signs. So this also comes under predominantly GA. Dengue fever usually do not have any cough, sore throat, or any upper respiratory features that suggest other infections. So COVID-19 will have a mild diarrhea in later stages. Flu usually none. There will be no abdominal symptoms. So dengue fever have petechial rashes. There will be positive tourniquet test if you can do it on emergency, on day 5 to day 6 or even day 3 to day 4, you could find the positive tourniquet test. There will be flushing, there will be spots in the gums suggestive of dengue. Enteric fever, there will be rose spots, which is rarely visible on the dark skin. It is usually found around the day 6 to day 8. Flu or COVID, the rash is very uncommon. The day of illnesses, as discussed earlier, influenza presents acutely, very acute, that is early presentation around the day 1 to 3. Whereas in dengue, the patients usually present around the day 3 to day 5 mark, where in the febrile phase, the high grade of fever of around 1 or 2 with chills, with severe fatigue, body pain, breakbone kind of fever. The patient usually presents around day 2 to day 5 in case of dengue. Whereas the day 5 or day 7 also a dengue patient can present in critical phase with low platelets, increase in hematocrit, increase in hemo concentration, dehydration, vomiting, headache, seizures, anything. COVID-19 patient usually present around day 3 to day 7 with the respiratory symptoms at peak. Around day 10, 7 to 10 is a usual common presentation of an enteric fever patient, where the patient would have tried an oral antibiotic over the counter drugs before coming to a emergency, where there will be sustained fever for around the 7 to 10th day mark, except stepladder fever, which will not touch the baseline, but also will not cause severe dehydration, vomiting, that kind of illness. So bedside, the first impressions: acute sudden collapse, think influenza; persisting fever with abdominal symptoms, think enteric fever; severe headache, myalgia, rash, positive tourniquet test, breakbone kind of fever, think of dengue; retroorbital pain. All these features are suggestive of dengue. There is cough, breathlessness, and no smell. These are common clinical presentations of COVID-19. So quick triage: is cough prominent? If yes, it is influenza. If there is acute body ache presentation in day 1 to 3, it's probably influenza. If the patient having anosmia and hypoxia as a finding, and mild fever, low grade fever, elderly, presenting around day 3 to day 5, it's possibly COVID. If there is no cough, although enteric fever we usually see dry cough in at clinical practice, usually most patients do not have cough. So, enteric fever, there will be abdominal symptoms with stapler kind of fever. In case of dengue, the patient will not have cough but can have rash or bleeding. So, rash or bleeding present, think of dengue. Bradycardia or abdomen symptoms, think of enteric fever. Anosmia or ageusia, think of COVID-19. Hope you learned the basic presentations of the common infections that present to the emergency for clinician practice and the approach to clinical judgment of the common illnesses. Thank you. This is Medicine Beyond Harrison. Let's meet in yet another video.